Okay, I think we're going to get started to keep everyone on time. Thank you so much for joining today. Erin, would you like to kick us off?
Yes, Sarah, thank you for joining us today on the webinar. During this webinar, the participants will be in a listen-only mode, but at any time during the presentation, you can enter questions into the Q&A box on the right-hand side of your screen, and questions will be addressed by the speakers at the end of the presentation. So please also use the Q&A box if you experience any technical difficulties during the webinar. And I did want to let you know that the Maryland Disability and Health Inclusion Program, in partnership with NACCHO, the National Association of County and City Health Officials, will be holding this training opportunity for Maryland public health professionals entitled Inclusive Communication, Engaging People with Disabilities, Inclusive Programming for Healthy Communities. The Maryland Disability Health Inclusion Program is housed at the Center for Disease Control and Prevention and is funded through a 5-year capacity building grant from the CDC aimed at improving the health equity for people with disabilities. The DHIP aims to train public health professionals to become culturally competent on matters of disability awareness and inclusion.
Thank you so much, Erin. My name is Sarah Lyons. I am the program analyst for the Health and Disability Program here at NACCHO. This is a partnership between NACCHO and Maryland Disability Health Inclusion Program to bring some training opportunities for Maryland public health professionals. So today I'm going to go over the learning objectives. After completing this webinar, participants will be able to identify the National Center for Health, Physical Activity, and Disability, or NCPAD, as a resource to support inclusive community health. Also describe the Community Health Inclusion Index, or CHI. Understand how the CHI can support inclusive public health activities for people with disabilities. And identify NACCHO and Maryland DHIP resources to support inclusive health. So for our agenda today, NCPAD will be providing an overview and some resources to share, and as well as a Community Health Inclusion Index overview. Unfortunately, we had an issue with one of our guest speakers, and we're not able to do a story from the field today during this presentation, but I will make sure to be following up with those details and to provide many resources on stories from the field for the future. And then I'll be finalizing the presentation with some resources from NACCHO as well as the Maryland DHIP resources, and then we can have some questions and answers for one of our presenters. So I'm really excited to have Allison Tubbs with us today from the National Center on Health, Physical Activity, and Disability. She is a certified exercise physiologist and health educator. She is the project coordinator of NCPAD, which is a CDC-funded National Center on Disability and Health Promotion Resource and Practice Center. Her work is focused on building inclusive, healthy communities where all people have access and opportunities for healthy living. I'm going to be advancing the slides for Allison today, so Allison, just let me know when you'd like me to move forward.
Awesome. Thank you, Sarah. Good afternoon, everyone. I'm excited to join you, and I'm just going to share with you some tools and resources that you can use in your healthy community programming to make sure that you are addressing the needs of people with disabilities. So, like Sarah mentioned, my name is Allison Tubbs, and I'm the project coordinator with NCPAD, the National Center for Health, Physical Activity, and Disability. We're headquartered out of Birmingham, Alabama, as part of the UAB and Lakeshore Foundation Research Collaborative. So moving on to the next slide, this is our tagline, Building Healthy Inclusive Communities, and just kind of sums up the work that we try to do across the nation. So we've been around since 1999, and we operate as a public health practice and resource center for information on physical activity, health promotion, and disability. So a lot of our resources are found on a website. It's nchpad.org. We call this an online hub. We have tons of fact sheets, tons of information about services services that can benefit really all ages and populations. So we try to serve people with disabilities across the lifespan, all the way from kids to older adults, and then all of the types of disabilities, so across the spectrum of intellectual to physical to sensory, and then with taking that approach with inclusion in mind. So how can we provide services that benefit everybody? So NCPAD is one of the 2 funded National Centers on Disability through CDC, and we're within the division of the National Center on Birth Defects and Developmental Disabilities. And a lot of our work is really centered around improving health and wellness and quality of life for people with disabilities. And we do this by supporting accessibility and inclusion in existing public health promotion programming. So figuring out how we can add adaptations to things that are already existing, and then also figuring out how to shape the future of health promotion programming so that inclusion is at the forefront and is not always added on as an afterthought. So we also work with NACCHO and Sarah, and they're one of our dissemination partners. And then we serve the 19 state disability and health programs, and Maryland is one of them. And we serve those programs through training and technical assistance, really like I'm doing here today with you all. Next slide, please. So this slide is about the Disability Impacts All of Us report that that came out from CDC Vital Signs a couple years ago. And in our prep work, I believe Sarah and Aaron mentioned that a lot of you have already received some disability awareness training through the work that they've provided to you. So I'm just going to quickly touch on this. It's probably not new information to you, but just some current data. This was actually updated a few months ago, is that we now have over 61 million adults in the U.S. that live with a disability. And this really boils down to 1 in 4. So 1 in 4 people in our country have a disability. And so we know that living with a disability increases one's likelihood to have chronic diseases, to be obese, to smoke, to be less physically active, and a lot more health behaviors. And the only way that we're going to help combat these health inequities is by really recognizing that disability is a health disparity. So someone can live with a disability and still be healthy. And disability is not a health outcome. So it's not something that we're trying to fix or cure. So this is just some basic data about that. And then on the chart on the screen, you can show that the differences between having these health behaviors if you have a disability versus if you don't have a disability, and the numbers are exceedingly higher for people that have a disability. Next slide, please. So this same report from CDC also gathered state-specific data and fact sheets, which we found in our work to be really useful in helping states and local programs make the case for inclusion. So you can utilize these free resources. They're on the CDC website, and then they might be within your disability and health program as well. But this is just a snapshot of disability in Maryland. So over 19% of adults in Maryland have some type of disability currently, and that's pretty close to the national average of 22.5. We also can see that healthcare costs associated with disability are over $7 billion in your state, and that across the board of health behaviors, Maryland is pretty similar to national rates, but again here taking note that the percentages of adults with disabilities, which are in green, are much higher, often double, if not more, than adults without disabilities, which are in red, and that's across the board of those health behaviors. Next slide. So laying the foundation, actually, if you'll go to the next one, sorry, I think I reorganized these. And one more. Perfect. Okay. So looking at, I say that there's a higher percentage for people with disabilities to have those health disparities and health behaviors. But I mean, why is this? Why is this such a big issue? And why are people with disabilities having these rates so higher than people without? So we can probably think of many reasons, and we know it's not a one-size-fits-all approach, but when we talk about what the barriers are to inclusive health and inclusive health services, they really fit into three main categories. And so we can look at architectural. So this includes items in our built environment like inaccessible paths of travel, places that don't have complete sidewalks, curb cuts, environments that aren't safe for walking or moving around, and then just places that lack connectivity. So a walkable and livable community is where we could choose to actively transport to the places we live, the places we work, where we shop and eat. And so environments like that are just more conducive and friendly and inclusive for everybody. So another barrier looks at programmatic services, and so this is the actual elements within a program or service and addressing inclusion with them. So things like transportation, trained and knowledgeable staff, inclusive communication and outreach. And then the last one, last but not least, certainly is attitudes. And this, people with disabilities report that this is the highest barrier that they experience. And oftentimes it's the easiest one to combat. So just some staff training, recognizing that we all have implicit bias is really important in attitudes. And it's the most important because the first point of contact for a person can really either make or break that encounter. So if we just have a welcoming environment, maybe we don't know all the answers, and that's okay. But if we can utilize our resources, ask questions, ask a person with a disability. If you don't know, don't assume. That can really change the way that the attitudinal barrier is perceived. Next slide, please. So kind of reverting back, we had a slide on inclusion. Sorry, Sarah, I've messed this up. But looking at the definition of inclusion here is so a way that we can reduce barriers for people with disabilities is to always think about inclusion in mind. And so 3 slides before, we had a definition of inclusion, and I'll just read it. I'm sure you'll get a copy of these slides. Perfect.
Yeah,
Thank you. So inclusion means to transform communities based on social justice principles in which all community members are presumed competent, are recruited and welcomed as valued members of their community, fully participate and learn with their peers, and experience reciprocal social relationships. So this is a definition of inclusion that we utilize in our work. You're welcome to use it in your things as well, policies or programs. And then one thing that I like to point out is that there is a difference between inclusion and accessibility. So you may have a program that has been modified or adapted to make it accessible, and oftentimes this really only meets the needs of one or a few people. But until you have a program that follows a systematic process, which is ensuring that it's accessible for people with disabilities by engaging people with disabilities in the process, then you're achieving that level of inclusion and ensuring that people with disabilities are successful and fully sustained and included within the program. Next slide. Okay, and this is the one on inclusive community. So thinking beyond just what inclusion means, what does inclusion mean at a community level? And within this, we're looking at how can we provide equal access and opportunities for healthy living services by implementing policy systems and environmental changes that look at increasing access to physical activity, healthy food, and healthy weight management initiatives. Next slide. And then do one more. So within this, we also have to look at health equity. And health equity is just making sure that you are valuing all individuals and populations equally. You are recognizing and rectifying where there are historical injustices, and that you're providing resources or programming specific to individual needs of people. Next slide. And on this next slide, there's a graphic showing what we mean between the difference of equality and equity. And so if we look at the top, equality is that every person gets a goods or a service. So everybody is equally receiving something, but when we look at the bottom, related to equity means that everybody is getting a goods or service or resources that meets their individual needs in an equitable manner. So everybody was receiving a bike at the top, but on the equity version, the bike is now customized and fits to their individual need, whether they need a hand crank, they need a taller bike, shorter, or a kid or youth sized. Next slide. And when we think about inclusion, we really need to address all levels. So if you work in the public health world, you've probably seen this model before. This is the Socioecological Model, which really looks at identifying inclusion from the individual level all the way up to structures and systems. So you can think of it from grassroots to grass tops. So grass tops are decision makers, organizers, or organizations in the community that have influence related to policy, system, or environmental changes, and they are connected to the different constituencies in a community that we're trying to reach at the individual level, which is the grassroots. And so these are the people who actually make up the community, make up a neighborhood, a town, or a city. And when we're looking at an inclusive community approach, we have to address every level within this model, and they all build on top of each other. Next slide, please. So now we're going to go over some tools that you can utilize to improve inclusion in your community or programming. Next slide. And the first one is your toolbox. So we have to start with our toolbox. This is the iChip, and iChip stands for Inclusive Community Health Implementation Package. And what this is, it's a set of interactive implementation tools that can help community health practitioners or organizations, coalitions, to look at incorporating and enhancing inclusion across all aspects of community health efforts. So what the iChip does is it provides specific guidance, information, and resources related to essential elements of inclusion, which are community health leadership, communication, policy, programming, planning, assessment, and training. Next slide. And so building off of the iChip, we've identified 6 essential elements for inclusive community health, and these are really a starting point to serve as you're doing your efforts to improve inclusion in your community. So if we start with assessment, communities should look at evaluating their level of inclusion to determine assets or strengths or gaps in areas for improvement. And then within leadership, so communities should establish a presence of disability inclusion in community-wide leadership and on health coalitions. Within health communication, communities should evaluate how effectively they're communicating health information to all members of the community. And then within training, so communities should look at receiving and providing proper training on inclusion and disability awareness. Policy relates to communities should establish policies for inclusion and add inclusion language into existing policies. And then the last one is about adaptation. So communities should look at adapting existing health promotion related programs to fit the needs of people with disability. Next slide. So the following are some tangible resources, tools, and guidebooks that you can use with each of these essential elements of inclusion. So the first one is called the Community Health Inclusion Sustainability Planning Guide, or the CHISP. And this is an addendum to a CDC guide called Sustainability Planning for Healthy Communities. So what this guide will help you do is will provide guidance on creating inclusive change and ensuring efforts to increase inclusive health inclusion in structures and places, and with a big focus on sustainability. So making sure your changes happen now and then last into the future. So it'll also provide guidance on how you can establish an inclusive health coalition. And it will help you develop, implement, and evaluate sustainable, healthy community changes, focusing on the needs of people with disabilities. So you can get this guide on our website at nchpad.org. Next slide. So a really key element to the foundation of inclusive community planning that we found in our work is you have to form an inclusive health coalition. Now, this doesn't necessarily have to be a new coalition, so like what the CHISP guide will help you do, if you have an existing health coalition, whether it be statewide, community, or local level, that's great. And so all you would need to do now is to ensure that the appropriate stakeholders representing disability are now part of that coalition and active in the planning stages of what the coalition is trying to do. So here on the screen are examples of some potential partners that you may want to incorporate into your local coalition planning. So these include disability and non-disability related groups. So if you don't have a coalition, this could be a great place to start, is reaching out to some of these people and seeing how you can get together to accomplish your healthy community goals. So some examples of disability organizations could be a local Special Olympics chapter, a Center for Independent Living, disability-specific organizations like a Spina Bifida Association. You can also reach out to schools that have adapted physical education coordinators, special education services, and then parent-teacher associations, so having parents of students with disabilities as part of your coalition. Another great connect is through hospitals and rehabilitation centers, especially for people who work in the medical and allied health professionals, like physical therapists and occupational therapists. Next slide. So this is another useful tool. It's a set of 9 disability and health inclusion policy guidelines, and it comes with a training manual. And this is really used to describe how to change local and state policies or plans to increase community health inclusion. So this resource is part of a broader campaign called Commit to Inclusion, where an organization can sign on to the campaign, upload their logo, and their commitment statement of what they're going to do to be inclusive. So I encourage anybody who has an organization in Maryland, if you want to join this campaign, you can sign on and be featured there. Next slide. So these are the 9 guidelines for disability inclusion, and they're really broad goals, can serve as a starting point if you need some help in crafting policies and program goals. So they look at making sure program objectives explicitly and unambiguously state that a target population includes people with a range of different disabilities. So the second one looks at program development, implementation, and evaluation, and all of those areas should include input from people with a range of different disabilities. The third one looks at program accessibility, so programs should be accessible to people with disabilities, socially, behaviorally, programmatically, communication, and in the physical environment. The fourth one, programs should address the individual needs of participants with disabilities. This might include accommodations that are specifically tailored to what the individual's needs are. Next slide. And then the fifth one, related to outreach and communication, is that programs should use a variety of accessible methods to outreach and promote and market to people with disabilities to recruit them to your program. Number 6, related to cost considerations and feasibility. So programs should use should address potential resource implications of inclusion. So what does it cost to have to train your staff to make sure they're more knowledgeable about disability? What equipment you might need to purchase to make sure that your program or your site is accommodating. Planning ahead for effective communication, so sign language interpreters might be necessary if you have a participant who requires that. And then number 7 looks at affordability. So a program should be affordable to people with disabilities, families, personal assistants, and caregivers. So if you're working in a fitness center and you don't have accessible equipment, there's not an elevator to access certain parts of the gym, maybe there's a track upstairs with steps only leading to it, you wouldn't necessarily require a person who can't utilize those services to pay a full price to access your fitness facility. So there are things called sliding fee scales. So that might be something that you would look at to make sure your program is affordable based on everything that somebody could access. So number 8 looks at 8 and 9 are kind of combined related to evaluation, so just evaluating the process and evaluating the outcomes. And the key component here for inclusion is that you're making sure that you're having feedback from people with disabilities or family members or caregivers all the way through the process and then within the outcome, and that you're utilizing any feedback that you get from those individuals. Next slide, please. So we've started using the grades tool to adapt existing health promotion programming that's evidence-based and has found to be effective for a general population. So this really focuses on, instead of reinventing the wheel, we utilize grades to create a set of adaptations to a program so that it now can be more effective for people with disabilities. And so grades stands for guidelines, recommendations, adaptations, including disability. And this is the paper, that publication that you can read more about this framework from. Next slide, please. So the grades tool is also organized into 5 domains, and these 5 domains we feel are essential for creating inclusive programming. So when you're thinking of areas within the program to adapt, this is where you would start. You'll start looking at the built environment. So where is a program being taken place? Are there barriers to the entryway to that program? Is transportation to get there a barrier? The next one looks at services. So are people providing the program trained and knowledgeable? Are the ancillary services that you offer inclusive? The next one looks at instruction. So are you varying your communication methods? Are you providing alternative formats or interpreters? The fourth one is equipment and technology. So examples, you may need adapted equipment. Maybe if you're doing a physical activity program involving bikes, you may want to look at having hand cycles, trikes, or other type of accessible equipment related to bikes and physical activity. And then also with technology, assistive technology may be an option here that you might need to look at. And then the last one is policy, and this can be big P policy or little p policy. It could be community-wide, or it could be really organizational specific or program specific. So those are kind of the 5 domains, bucket areas to look at when you are identifying areas that you need to address related to inclusion. Next slide, please. So I mentioned assessment as one of the 6 essential elements of inclusion. So, it's important to assess. If we work in the public health world, you can't report on what you don't measure. So we have to have assessment to be able to prioritize where we need to go based on what the needs are, greatest needs, or whatever we're focusing on at that moment in time. So we have an assessment tool called the community. It's a community level assessment, and it's called the Community Health Inclusion Index, or the CHI. And what it does is it provides individuals and organizations with a resource to really evaluate levels of inclusion within your community and then the individual environments that comprise them. So the goal is to provide a local level assessment on inclusion of healthy living resources in a community. And the CHI tool has 3 parts, which I'll get into in much more detail later on, but it's a macro assessment, it has an organizational assessment, and then an on-site. Next slide. So the CHI can be used to identify inclusive health opportunities within a community. So on the slide here, if you look at the top left, if we think of the black dots in the upper left as potential opportunities for health, they might include recreation sites or grocery stores or farmers markets, maybe healthcare, physician offices. But within all those sites, we don't know which ones are inclusive or accessible. So what we can do is utilize the CHI tool to help provide a picture of inclusion within the community. So it helps us see where there are inclusive locations that promote health, and then now we can overlap that, green dots being sites that are inclusive with the black dots being sites that provide opportunities for health. So in essence, once we've done this mapping within our community and we can overlay where the inclusive opportunities are, we're saying that the likelihood of engagement in health behaviors and for people to utilize these resources and services will go up if people know where they are and how to access them. And then long-term effects can be reduction in chronic diseases, improved health behaviors for people with disabilities, and so on and so forth. Next slide, please. So the CHI can also help you gather a community snapshot, so you can look at what are your assets or strengths, and then what are your gaps and areas for improvement. So on the slide here, we have a picture of two examples of a public bus stop. So on the left, we're looking at a good example. So we have assets and strengths. We have a sidewalk buffer, which shows a path in between a green space in between the sidewalk and the roadway, which provides a safety buffer. This is a clear, open, it's a clean environment. It looks relatively safe. I can't tell if there's lights, but there probably is lighting. We have a bench provided for seating. It looks well maintained, and it has a shade and shelter available. On the flip side, on the right, we have definitely an area of improvement for this public bus stop. So we have trash everywhere. It's just kind of a sign in the middle of nowhere. There's really no dedicated area for someone to sit to wait for the bus. There's no shade, and it just doesn't give a vibe of a safe and welcoming environment. So that would be a gap, an area that we want to improve. Next slide, please. So continuing with this transportation example, we had the bus stop first, now we have the bus, and then having a person with a disability trying to get on the bus. So on the left, we have the bus driver actually came out, knows how to operate the lift. The individual who's using the wheelchair is able to roll up, and then they're going to be able to get into the bus that way. On the right, we have no transportation worker present, so this person is just left to fend for themselves. We don't have a wheelchair ramp, we have steps, and so basically they're not getting on that bus. But these are some things that the CHI can help you look at. So this is a broad example of transportation, so the CHI tool will help you assess what your staff competencies are, what your services for people with disabilities are, information about the accessibility of your transit system, so identifying where those bus stops are that are in need, and then maybe how many buses that you have that actually have working ramps and wheelchair available lifts. And then there's also, through the macro tool, you can look at the a website, so transportation system as a whole. Next slide. So apologize for the small text, but hopefully you'll get these slides and can look at them and follow up. But this is just a chart of everything that the CHI tool covers. So we're starting at the community at large, and then we break that up into sectors. So we have schools, we have healthcare, we have work sites, community institutions, and organizations. And then within those sectors, we have specific sites. And so we want to look at the accessibility of available physical activity, healthy eating, and then community design venues. And then within level 3, this is the inclusion domains that we got from the grades tool earlier. So we're looking at the built environment, the equipment, our programs and services, our staff and policies. And then we have constructs. So these are topics and areas that we might look at within an inclusion domain, such as maybe playground equipment or alternate materials, staff training, healthy eating or wellness policies. And then level 5 are the questions that the CHI assessment tool actually asks to help you assess the level of inclusion within each construct. And then finally is the 3 CHI assessments at the bottom. So we have an on-site assessment, we have organizational, and then we have the macro community at large. Next slide, please. So getting into the macro community level assessment. So this section involves some information gathering. You'll conduct some research and interviews. You'll interact with community representatives that have knowledge of policies and programming related to maybe public transportation, community design policies, and then community health promotion coalitions. Next slide. So this tool can be conducted through internet research or phone interviews. It's also a great tool for engaging or involving new partners. So you might become connected now to your transportation agency or your city planning department, social services, or other community coalitions by doing this exercise of utilizing the CHI. Next slide. So the next component is the organizational assessment, and this is an online survey. You can send a link to your community partners to be able to fill back and then provide data back to you. Next slide. So the 3 areas that the organizational one covers are programs. So you'll be looking at inclusive aspects of nutrition and physical activity programs. You'll be looking at staff training, so the extent to which staff are educated and knowledgeable about working with people with disabilities. And then policies, so looking at both health promotion and inclusion policies within that site. Next slide. So the organizational assessment part of the CHI also includes a capturing readiness for inclusion. So we want to look at how does the organization value implementing changes that support inclusion? Are they even committed to making a change? Are they confident in their abilities? Are they knowledgeable about how to make these changes? And do they have the resources to make changes happen? So this readiness for inclusion oftentimes happens on a continuum of change. And if you're coming in as the community health organization or the public health worker, you can really help work with an organization, meet them where they're at on this readiness for inclusion scale, and then help them maybe get a little bit further down the road by providing training or technical assistance or information. Next slide. So this is the last part of the CHI. It's the on-site assessment. And so this really looks at the environmental factors that have a unique impact on community participation and access to healthy lifestyles or opportunities for people with disabilities. So this is an observational assessment of the external environment. So you're looking at how do you navigate to the site, whether it's through public transportation, whether it's walking or driving. And then you're also looking at the internal environment, so the accessibility of paths within the building, entrances, restrooms, and then we're going to specifically call out those nutrition venues. So are there cafeterias? Is there a grocery area? Is there farmers markets or community gardens? And then we're going to look at physical activity venues, so things like a fitness center, a swimming pool, playgrounds, or trails. And then lastly, we'll look at healthcare venues, so identifying waiting rooms and exam rooms, and so within accessibility within all of those components. So the on-site assessment can be done digitally on an app with your mobile device or tablet. It can also be done via paper copy. And it's usually done with a representative from the organization that you're conducting the assessment for. And this is really beneficial to have because when you're going through and doing these check-by-check assessments, it's really eye-opening for people who work in that site. So things that they may never have thought of is maybe they have a trash can that's blocking the access to drying your hands or paper towels in a restroom. And it's as simple as just moving the trash can somewhere else so that a person who's using a wheelchair can get to that spot. So we encourage you to utilize a representative when you're doing these assessments, because you can have some of those small wins that can take place immediately. So overarching, the CHI tool really works from the outside in. So we're starting with a scan of our external environment, and we want to look at not only the places that we're assessing in isolation, we want to have a snapshot of the entire community at large. So how everything connects and how everything works together. So we want to look at how people get there through public transportation. If they're driving there, are there accessible places to park? When we're looking at the, so that's why we really assess the external environment first. And then once we get into the building itself, can people move around the building? Is it welcoming and friendly? And can they participate in the actual programs and services like physical activity, healthy eating, or health promotion venues that the site offers? Next slide, please. I think we've covered that, so we'll skip that one and go to the next. So these are just some pictures of things that you might find in your external environment when you're doing a CHI assessment. So on the top left, these are truncated domes that you would see as you approach a curb cut, and these serve for people who have visual impairment or are blind to know when the path changes from a sidewalk to a roadway. Below that is an example of automatic doors. This is universal design. Right here you see in the middle there's a curb cut. And then on the far right, this individual is using what's called a SMART tool. It's the yellow tool that she's placing on the sidewalk. And so what this does is helps you determine the level of grade and slope to know if that sidewalk is accessible. Next slide. So again, a couple more pictures of things that you would utilize using the CHI tool. So here we have the SMART tool again on the left. It's placed on a slope, and so you'll be able to measure what that grade is. And then on the right, a person is using what's called a pressure gauge, and this measures the level of difficulty to open a door. So when doors aren't automatic, there's a certain weight and poundage that doors need to be so that they are accessible. Next slide, please. So lastly, I'm just going to close with some examples of inclusion in action, and you can go on. So the first one, mentioned before, the Commit to Inclusion campaign, but since the launch of that campaign, we've developed a continued effort called the Partnership for Inclusive Health. And if you log onto this website, you could join the partnership, but you can also see what organizations are doing related to their inclusive community health work and get some examples. And on the next slide, this is an example of the National Recreation and Parks Association. Their commitment to inclusion was creating a Parks for Inclusion initiative. It's a 3-year commitment to making sure parks and recreation programs and facilities are addressing people with disabilities. And on the next slide, we did a micro grant program with them. So they put out a call for park and recreation facilities to submit a micro grant on how they were going to address inclusion within their programs. And so some examples of the initiatives were a adaptive bike program, a intergenerational community garden, and then the last one, this is my favorite, is called Sense Tents, and it was in Minneapolis, Minnesota, and it's basically having sensory-friendly tents at public events and spaces where maybe people with autism or who just need a break and need a place to go calm down and collect their minds and refresh their bodies can go to these sensory tents, and they have engaging activities to allow somebody to self-regulate and be able to come back to the public environment. There's another organization called Culture City that's actually based in Birmingham, and they're doing these sensory-friendly tents and spaces across the nation. So they've partnered with a lot of sporting teams, and you'll see that that facilities are now becoming sensory friendly and will provide a bag upon entrance, which might have noise-canceling headphones and other fidget tools and things to help children or adults who might need that in those spaces. Next slide. So this is an example of a partnership with America Walks, and it was called Designing for Inclusive Health. This was another microgrant program. We worked with 3 communities. The first one was Access Portsmouth, and what their project was is they used Google Maps to map out accessible places within. They started in their downtown, so they had mapping of businesses, restaurants, storefronts, that were accessible, and then they actually were able to grow this, and they've mapped the entire state of New Hampshire now. And so they house this on the Access Portsmouth website, where a person with a disability can go on and check out a place before they actually go there and might experience a barrier. In Minnesota, this is the Zeitgeist Center for Arts and Community, and they did tactical urbanism projects where they set up pop-up demonstrations in the environment in the community that were temporary but showed constituents in the community what long-term changes might look like. And then they were able to utilize those to influence transportation and community plans. And then the last example, which was in Ashland, Virginia, the Hanover County Health Department, they focused on training people with disabilities to become walk audit leaders. They partnered with their local ARC chapter, and they had the people go out and do walk audits in their community, and then they were able to provide the data back to their local county health department, and it was able to provide input to their community health planning process and inform other policies and projects. Next slide. This is examples from the Reaching People with Disabilities Through Healthy Communities project, which was in partnership with the National Association of Chronic Disease Directors. So on the left, we have a picture here of these are power wheelchair charging stations that have now been set up across the nation in local parks and then at government buildings. And this individual pictured here actually came up with the idea, and he invented this. So it was really neat to see that kind of blow up and go nationwide. On the right, this is an example from New York, and this is a fully inclusive crosswalk that not only has the flashing lights, but it also has audible signals to indicate when it's safe to cross the street. Next slide. So you may have heard of the Monday Healthy Monday campaign or Monday Mile in New York. They worked with their Monday Mile program to identify inclusive walking routes, and then similar to the project in Virginia, they had people with disabilities trained as walk audit leaders to provide input on those routes. And then in Montana, they utilized walk audits to create a new wayfinding system. And so the wayfinding system throughout their city mapped out what the routes looked like, told you how long it was going to take you to get from point A to point B, or hey, it's a 1 mile walk to this park, go check it out, things like that. And we found that the more information you can provide, the better. So wayfinding is really best practice. Next slide. So this is our HiWalk campaign. It's a campaign to rebrand walking. We started this when the former Surgeon General released the call to action on walking, because walkability has really been a big topic related to community health and programming. And so just the premise of this campaign is that walking is an inclusive term. So however you get from point A to point B, that's how you walk, or that's how the individual walks. And focusing more on how we can utilize walking as an inclusive term so that we don't have to have the synonyms of wheeling or pushing or rolling, which can just cause confusion. So everybody walks however it looks for you. You might use a wheelchair, you might use a cane, you might use 2 feet. That's your form of walking. And so that's what this campaign is about. And it has ready-to-go resources that you can use in your walking programs to make sure they're more inclusive. And I think this has been utilized in Maryland before with a transportation campaign, so maybe you've seen this already, which is awesome. Next slide. So recently we've put out some new resources related to walkability and inclusion. So we were able to partner with Mark Fenton, and he's a national transportation and planning consultant, and he created a video with us on the power of a walk audit, and it basically talks about why you should do walk audits in your communities and how you can ensure that people with disabilities are part of that process and can be trained as walk audit leaders. We did one on tactical urbanism for inclusive community design, so gives you some strategies on how you can utilize those tactical urbanism projects to influence inclusive design in your community. So the picture on the bottom is a new crosswalk that was at a school that just added a level of safety. There was a goat trail where kids were walking from a neighborhood to the school, and there wasn't a safe path, and also that it wasn't encouraged for people to walk because there wasn't a safe path. So by doing this pop-up demonstration with sidewalk chalk, the urban tacticalism, it was out for a couple weeks. People within the community saw it and saw what could happen if there was a permanent crosswalk put there, and then the school was actually able to work with the city to implement this and have a permanent crosswalk put in. We have an article on how to conduct a walk audit, and we have some new videos through a summit that we hosted in Alabama called the Alabama Walk Summit. Next slide. Next slide. I'm going to skip through these quick so we can save time for questions. But this is a Solutions for Inclusion dashboard that we're currently building. So it's not available yet, but this basically pulls together everything that I've mentioned before. So from assessment using the CHI to matching your assessment results to the grades to identify areas for adaptation. And then you'll be able to connect it to inclusion elements, which are how-to resources like those videos and articles and fact sheets that you might find on our website. And then once you compile all that together, you'll have an inclusion plan that you can use as a starting point with your work. So I'll be able to follow up with Erin and Sarah and make sure everybody gets access to this database once it's developed. Next slide, please. And then this is another project that we are currently piloting. It's called NICIP, or NCPAD's Inclusive Community Implementation Process. And it's basically just how do we create inclusive community changes at a local level, and what does that implementation process look like? So right now we have 3 stages. It's 15 steps. This is based on implementation science, and we're currently piloting it in Florida, South Carolina, and Minnesota. Next slide. And this is what the framework looks like. So it's kind of busy. Maybe from our pilot we'll be able to narrow it down. But basically, if you start in the middle, it's a funnel. We call it a knowledge funnel. So you're starting with your evidence-based health promotion program. Then you're going to adapt that program. Your end result is an adapted program. Then you would take that into your 3 stages. So stage 1 involves planning. So like I mentioned earlier, having a convening of an inclusive health coalition, conducting your assessments, and then from your assessments determining what your inclusion plan is going to be. Once you have your inclusion plan, you're aligning that at your local context wherever you're doing the work, whether it's in 1 community or in 5 throughout your state. Maybe each community looks different, so you want to align that plan. And then in the 3rd stage, you get to actually implementing and evaluating. And then the whole process is circular in nature, so builds on top of each other. And I believe that's it. Final slide has our contact information. So we offer technical assistance and training on pretty much anything related to health promotion and disability. So you can contact us through our 800 number. We have an online live chat and email.
Thank you so much, Allison. That was so fantastic and such really just a wealth of knowledge. I've been working with NCPAD for the past 2 years, and every time I see a presentation like this, I'm like, okay, that's why they're so busy. You guys are doing such amazing things and it's just really always so exciting to hear you all talk about it at once. So I'm just going to flash forward a little bit past the slides that we were going to have. We have a couple minutes left for questions. I'm not able to see the questions because I have the screen share open, but if Francis, if there are any questions from the audience, I'd be happy to take them.
Hi, Sarah. Thank you. So we don't have a question so far. We do have a comment from Tracy Ann Hogland, who would like to let everyone know that Walk Boston could be a good resource for walkability in Massachusetts if anyone would like to partner with them. But that is the extent of our questions so far. But I would encourage those on the line to use the Q&A box at this time so we can make sure to get your questions answered.
Sure. I actually have, while waiting for questions, if any do come through, just interrupt. But I actually had a question, Allison, about the Inclusive Health Coalition concept. I'm pretty sure some of your mini grants and folks that you've worked with in the past have developed Inclusive Health Coalition.
Sure. So we're
great,
currently working in South Carolina, and part of the NICET project that I mentioned, which is the pilot, the Inclusive Health Coalition is really the foundation of that project. And South Carolina had great capacity. They have a program statewide called Eat Smart, Move More, which is basically just their general health promotion coalition. It's got a variety of organizations that are part of it. And what we found to be effective with South Carolina is they have a really strong independent living center called ABLE South Carolina. And ABLE South Carolina came on as being the leaders for the Inclusive Health Coalition. So compared to some of the other states that we've worked in, we found that it was really effective when you had a strong disability leader being the leader of the Inclusive Health Coalition, and then everything just trickled down from there. So how they've been able to influence the work in the state is the Inclusive Health Coalition is the one who are doing the assessments. They're the ones who are forming the inclusion plan. So it's not necessarily just the public health professionals who are going out and doing those assessments. It's the coalition as a whole determining who's available to go maybe do the CHI, and then they bring the results back to the entire coalition to make decisions on priorities and things, gaps and things to put in the inclusion plan. Yeah, so I would start, I mean, the CHI tool, it kind of seems overwhelming because of all the components, but I would really start there and maybe just starting with, gosh, you could start with the OnSite tool because, I mean, that's really just the checklist of getting out there in the field. You could do it in your own building. You don't necessarily have to do it with a community partner. So it's walking around your space and noticing things like accessible parking or curb cuts and maybe barriers that might be present getting into your actual building. So I think starting with the on-site assessment just to maybe kind of educate yourself about what the areas of inclusion could be, and then you could go from there and do the macro assessment, which doesn't necessarily involve talking to other people. You could do some own research of your own by scanning those websites of your state transportation department and things like that.
Great. Thanks so much. So we're almost at the top of the hour, so I just wanted to give a quick reminder for everyone. I know we've shared this on the end of all of our webinars that we've done over the past 6 months or so, but This is just a reminder that we still have our NACCHO Health and Disability 101 training, which if you're really just trying to get your foot in the door about inclusion, this is a really great resource. It's free to access through our NACCHO University platform, which is our learning management system. So that's the direct link below. And I also wanted to make sure you have myself and Erin's contact information, as well as Marilyn DHIP's website. So thank you again for participating in today's webinar. We'll be sharing the recording of today's webinar as well as the PowerPoint slides via email. And you'll also receive an evaluation